welcome. We are continuing with the disorders of the endocrine system. Last time we talked about shock, how it was to be treated using norepinephrine, and now we are continuing with the disorders of the adrenal gland. And today we are talking about Cushing's syndrome. Cushing's syndrome is a group of conditions. It is not one thing to find. We say a syndrome is a group of signs or a collection of signs and symptoms. So this condition is associated with secretion of excess glucocorticoids. Glucocorticoids, what am I talking about? I'm talking about cortisol, or you can also talk about corticosteroid. But cortisol is a major glucocorticoid that we talk about today. That when you have it in excess, it causes a lot of conditions, which this man Cushing said that it is a Cushing's syndrome. And today, today we want to talk about that, and we shall leave it. So, what are the causes of Cushing's syndrome? It can be caused by SCTH-dependent causes and SCTH-independent causes. What is SCTH? This is adrenocorticotropic hormone. And this hormone, its release occurs in the adenohypophysis. And the release from adenohypophysis is stimulated by the corticotropin-releasing hormone from the hypothalamus. So when it is released, it goes to the adrenal cortex, and when it encounters cells of the zona granulosa, it will cause release of cortisol, the glucocorticoid. Sorry about that. So now, when cortisol is released, we said we have SCTH-dependent Cushing's disease and SCTH-independent Cushing's disease. In SCTH-dependent, it depends on SCTH. SCTH is the cause. This one, the causes are majorly four. And SCTH, it stimulates glucocorticoid release from adrenal cortex, the outer layer, the granulosa. So, what will happen? Because it is SCTH dependent, the first cause is the tumors of the pituitary gland. In Cushing's disease, there is a tumor of the pituitary gland which causes hypersecretion of SCTH. So SCTH will go, because it is in excess, it will go to the adrenal cortex, cause hyperplasia of corticocells, and those cells, when they increase in number, they increase in secretion of glucocorticoid, cortisol. That is one. Two, another cause of SCTH dependent will be a hypersecretion of corticotropin releasing hormone from the hypothalamus. That one, when it is too high, much SCTH is released and much cortisol will be released. A third point, which can cause that SCTH dependent, will be injection. There are therapies of SCTH. Some people are taking therapies in excess, and that can cause SCTH dependent Cushing's disease or hypersecretion of cortisol. Another point is ectopic SCTH secretion. There are tumors like abdominal tumors, lung tumors, that when they occur, they can end up secreting some adrenocorticotropic hormone. Those ectopic secretions are also other causes of high SCTH. Now we are having SCTH dependent done. Now we go to SCTH independent stage. In SCTH independent stage, the first cause is adenoma or adenocarcinoma. Yes, adenoadenoma or adenocarcinoma. It means they are having tumorigenesis in the adrenal gland. Yes, so when you have hyperplasia, cancerous hyperplasia, within the adrenal cortex, much cortisol will be released into blood. Another cause of ACTH independent will be injection, self-injection of the adrenal glucocorticoids. If you administer to yourself a lot of glucocorticoids, you end up having a lot of cortisol in blood, which didn't come from the adrenal cortex. Yeah, those are the two major causes. So now I want to talk about, that is the Cushing's disease. That is the cause, yeah. Now I want to talk about, what should I talk about? I want to talk about, those are the causes. So I want to talk about the effects. How is it bad to have a lot of cortisol? You know, cortisol is basically in normal times released in times of stress. So now we're having no stress. We're having a lot of it. First and foremost, how do you test that you have ACTH independent or STH dependent? To check whether this thing is ACTH dependent Cushing's disease, you can check there's a metrapone test here. That one is used to check whether you have 11-deoxycortisol. That is an intermediate in formation of cortisol. So 11-deoxycortisol, when it is high, that means it is ACTH dependent. When it is not there, it means it is not ACTH. When it does not change, yeah, because when it changes, it means it is influenced by outer hormone. Now, when it does not change, it means it is not ACTH dependent. Another thing to check is you can check levels of ACTH when they are high or when they are not detectable. When they are not detectable, but you have a lot of cortisol, it means that is ACTH. It means that is ACTH independent. What are the results of having a lot of cortisol or Cushing's disease? Cushing's disease, first and foremost, this cortisol is it's like it prevents the utilization of glucose by peripheral tissues. Yes, but it increases the glucose in blood, hyperglycemia. That is the role of cortisol. But what will happen when a person has Cushing's disease? You will have hyperglycemia, yes. You have increased glycogenolysis, yeah. So that is occurring in the liver, glycogenolysis, gluconeogenesis, and gluconeogenesis involves utilizing the proteins, utilizing the lipids. So when you utilize the proteins, for example, under the skin or subcutaneous tissues, you will have weakened tissue there. But now, as you are also having lipolysis in the peripheral tissues, these lipids are too many, but they will be distributed around the center of the body. Truncal base will happen. So truncal base, when it happens, there is a redistribution of the fats to areas like face. You will have them on face. To areas like the hump, you will have hump bulging there because the lipids are posted there. And when deposited around the belly, for example, you will have stretch marks, reddish purplish stretch marks, on the skin of the abdomen, because you utilize the proteins from there, but again you are packing a lot of fats there. Yeah, you also have because of too much cortisol or too much STH. When you have too much STH has melatonin stimulating hormone like activity. That MSH, it acts like MSH, and it will cause hyperpigmentation of the body. Another effect of cortisol, too much of the cortisol, we've talked about preventing utilization of glucose from peripheral cells, by peripheral tissues. Means glucose is accumulating in blood. You get adrenal diabetes. In adrenal diabetes, you also have glucosuria. And you know glucosuria is attached to several effects. For example, glucosuria, when it occurs, it will cause polyuria. Yeah, you want to urinate a lot, urinate every time. Polyuria. From polyuria, you get electrolyte loss. You lose electrolytes from the body. Those include phosphates, potassium, sodium. You're losing them from the body because of glucosuria. I talked about glucosuria, polyuria, and loss of electrolytes due to osmotic diuresis. Yeah, when you lose a lot of electrolytes from the body, osmotic diuresis. That osmotic diuresis is caused by glucose. Glucose in urine within the nephron is caused nephronic tubules. It is causing hyperosmolarity of urine. So the osmotic diuresis occurs in which the electrolytes are lost. Another thing is that you have dehydration of cells. And dehydration of cells occurs due to osmotic diuresis, in addition to a lot of hyposmolarity outside cells. Hyposmolarity outside cells causes dehydration. We have 4 more other points to talk about, and I want to talk about another effects of glucosuria. Those are 4. So another 4 effects is that you have polydipsia. Polydipsia means you're taking a lot of water. You need water. You are thirsty. You are thirsty every time because the thirsty center has been activated, and the thirsty center is activated when cells are dehydrated, as I've talked about the dehydration last time. And another point from polydipsia, you get what we call polyphagia loca. You eat a lot, you need to eat every time, because when you have a lot of glucose is not, there is no insulin response sensitivity. So you have to eat a lot and every time. The last point can be wastage of muscles, wastage of muscles, because proteins are being called for to intervene in synthesis. So thank you.